Today on Prime Report.
What happened was we get this freaking $20,000 bill. I was like, since when, if you have health insurance, is a surgery 20 grand?
So we're on the phone talking to this lady and she's like, okay, your guys' new plan is $830 a month with the plan that you have now.
I'm like, well, that will take 60 to 90 days for us to tell them that you paid that. I'm like, well, I have the receipt. Can I just give that to them? Call my insurance company again. Nope, has to come from the hospital.
Okay, this is actually ridiculous. I can't.
Welcome back to Prime Report. Health insurance in the United States has become so outrageously expensive and so intentionally confusing that more and more Americans are calling it what it really is, a scam. A system that was meant to protect working people from financial ruin is now the very thing pushing them toward it. Premiums are skyrocketing, coverage is shrinking, and just when you need help most, you're met with endless paperwork, denials, and loopholes. People are reaching their breaking point. They're paying hundreds or even thousands every month, only to be told their care isn't eligible. This isn't just inefficient, it's predatory. And for many, it's life or death. Here is what people have to say.
My husband got his appendix out a year ago-ish. What happened was we get this freaking $20,000 bill. I was like, since when, if you have health insurance, is a surgery 20 grand? Surgery is expensive, but for an appendix surgery and we have insurance? No freaking way. We pull up the bill and we find out the insurance is like, sorry guys, we can't help you pay for any of this because appendicitis is a pre-existing condition. A pre-existing condition. Do you know what appendicitis is? Have you ever heard of it before? Because once you get appendicitis, you got like limited time before you got to get that baby out. People aren't out here living with appendicitis for years on end. Like what? First of all, my man's had your insurance for almost a year before he started getting a pain in his stomach. One day, his stomach started hurting. So we went to the freaking doctor and they ran a test and they're like, oh, you got to take your appendix out. Took it out. Pre-existing condition? Nah, man. Of course we appealed it, right? We're waiting out. We're giving them their 90 days to decide if they're going to help us or not. But like, really?
So this is just a quick rant about insurance here in California. So whoever this reaches, this reaches. So me and my husband recently got married in March. And I finally was like, okay, we should probably get our insurances together because I don't want to get in trouble for like fraud or anything when it comes to taxes. I'd rather me and him just do it right away. Mind you, my daughter is already covered through Medi-Cal. So that's covered for. So me and my husband, I got on the phone and I talked to Cover California. I was like, hey, me and my husband recently got married. I want to go ahead and get a plan started with me and him and my daughter. But obviously she's covered through Medi-Cal. So me and my husband individually, I paid $130. My husband paid, I think, $110 for his own insurance and for my insurance through Covered California. So we're on the phone talking to this lady and she's like, okay, your guys' new plan is $830 a month with the plan that you have now. $833, you're telling me that I went from paying $130 to $800, and that's not even including my daughter. Like, my daughter's not even covered because she's covered through Medi-Cal. Mind you, me and my husband, we make less than $80,000 a year together. I literally bursted out into tears because I just could not understand like how our insurances went from $130 to together $833, and that's not including my daughter, and I'm 6 months pregnant, and I'm just like baffled. Like, I'm at a loss of words.
Someone who is not dumb, please help me understand this. I had surgery January 3rd. My deductible and my out-of-pocket max is $7,500. So the day before surgery, I go in and they're like, just a reminder, when you come in for surgery tomorrow, you're going to have to pay either half of it or the full $7,500. And if you pay half, you're going to have to pay $7,500 eventually. And I'm like, oh, okay. Well, my credit limit on that card is $8,000, so I guess I'll just pay for the full thing. So the morning of surgery, I go in, I pay $7,500, and I'm like, great, at least that's all I'll have to pay this year for medical things. So at least there's that, right? Now I need this prescription. It's a specialty prescription, so it comes from a specialty pharmacy. Even getting the prescription and getting them to like send it to me is a whole other thing. But I call them, I'm like, hey, I need this prescription. And they're like, okay, what's your credit card number? But I tell them I've already hit my deductible. So prescriptions after that should be $0 because I paid everything that I'm supposed to pay for the year. They're like, well, I think you paid it to the hospital, so we don't have any record of it. And your insurance doesn't have any record of it, so you're just actually gonna have to pay us if you need this medication that I have to have. It's an injection, I have to have it. So anyway, I call the hospital and I'm like, can you please like tell my insurance company that I paid the $7,500 to you? They're like, well, that will take 60 to 90 days for us to tell them that you paid that. I'm like, well, I have the receipt. Can I just give that to them? Call my insurance company again. Nope, has to come from the hospital. So their advice to me was to pay $1,500 for this injection that I need monthly. Have them send the injection to my house, just pay for it every month, and then hopefully one day I'll get reimbursed for these specialty pharmacy medication drugs that I need. So am I just dumb, or like are people just paying for things, and is that what I'm supposed to do? I've been on the phone for hours and hours these last couple weeks. I've been in tears. I've cried on the phone to people, like the pharmacist, and no one can give me a straight answer for what I can do to resolve this.
I am literally paying for health insurance not to have health insurance because my deductible is so fucking high. And when I called the representative today, she was like, oh yeah, your deductible's really high, so like there's really nothing we can do. And I was like, seriously? I'm literally, and I even asked her, I was like, so I'm paying for health insurance to not have health insurance. And she went quiet. And I could literally hear the silent yeah. And she goes, is there anything else I can help you with? And I was like, no, and I hung up. I hate it here. I hate it here so fucking much.
Hi, do you want to know what's so wrong with America? Because I will tell you, okay? This is a letter of denial from my insurance company. Do you know what it's denying? It's denying the entire inpatient hospital stay I went to the emergency room. The ER physician admitted me, okay? That was early on a Tuesday morning. I left on a Friday. I had different tests done every single day that week. I was anesthetized, okay, to try to figure out what's wrong with me because I can't eat, okay? So this is from the insurance, fucking Blue Cross, okay? Do you know what it says? It says, I don't know, I'm anemic, but not anemic enough. My level wasn't enough. This is actually a joke. I wasn't vomiting enough, okay? But also, I was having tests done, and I was on a fluid-only diet, like a liquid-only diet. I wasn't even eating, so how would you even know? This is actually ridiculous. I can't. Because I don't have indicators of terminal illness, or because I didn't need a fucking feeding tube placed. I don't understand. So now on top of trying to figure out how I can make myself well and continue the whatever fucking tests I need to take to figure out how I can get myself healthy again, now I have to worry about bullshit appeals on this bullshit. Because you at a desk decided I'm not sick enough. Fuck off.
Well, if it's not one thing, it's another. I just got a call from the pediatric dentist that is going to do my 5-year-old's capping on his teeth. He's got some dental issues here in the front, and we need to put caps on them. So we've been on a waiting list to get that done. They called today to try to set up something, and I asked, how much this is going to cost. We have dental insurance, but my insurance does not cover anesthesia, number one. Who is out here getting dental procedures or any procedures medically done without anesthesia? Why wouldn't you cover anesthesia, especially for a child? Like, I don't understand that. So for 40 minutes of anesthesia, they want $900. 40 minutes. And that doesn't even include the price of the actual procedure, which is $600. So $1,500 to get this done. And that's out of pocket. So I was like, okay, well, is there any way we can do a payment plan? I can make a deposit and then do a payment plan. No. It is $1,500 due up front before the procedure. So, I mean, honestly, like, in this economy, who has an extra $1,500 laying around? Because I don't. I mean, a lot of times we are paycheck to paycheck. And that's just the sad reality of the times that we're living in. And I just don't know what I'm going to do. Like, it's so frustrating. Like, he needs this procedure done, but I don't know, y'all. Our healthcare system is just a freaking joke. Like, what's the point of even having insurance at this point? Like, if they're not going to pay for anything. I mean, they won't pay for the anesthesia. Like, that part gets me the most. Like, I might be able to get reimbursed some on the procedure, but I don't have the money up front to do it. So, like, I'm going to have to probably take out some sort of loan or a credit card to just be able to do this. Like, it's just absolutely ridiculous, and I'm just done with it. I'm over it.
Here's a perfect example about what's wrong with healthcare in this country. So a couple months ago, I go to the urgent care because I had ear pain and I thought I had an ear infection. So as one should do, they go to the doctor. And because of that visit, I was charged $300 and my insurance was charged $500. Now, I understand needing to pay for medical care if you get medical treatment and sufficient medical care, but this doctor looked in my ear, one ear, looked in it, told me no ear infection, which was good, but you have blocked earwax and that you should probably follow up with an ENT. So I didn't get any sort of treatment. I didn't feel better after going. And I have to pay $300 for that. She didn't check anything else on me, see if I had sinus issues or whatever. And when I walked in, the receptionist didn't even confirm that they take my insurance. So there goes $300.
Everything is a scam in America. Every single thing is a scam. Why do I need dental insurance if I have medical insurance? Is my teeth not medicinal? Is it not medicine? Is it not medical? Is a dentist not a doctor? Why do I need different insurance than my medical insurance for me to get my teeth cleaned? If I have car insurance, I don't need different insurance for the steering wheel because it's part of the car. The car is insured, so the steering wheel is insured. Is my teeth not out in my mouth? Is my mouth not on my body?
So, my freaking tooth's infected. It hurts like fuck. I go to the dentist to find out, oh, you're gonna need a root canal. Great. How much is that gonna cost? And I have insurance, and I feel like I have decent dental insurance for once, but like, I feel like I'm still gonna end up having to pay hundreds of dollars out of pocket for this, when it's like, it's kind of medically necessary because it's infected. I don't know. Like, what's the point of having insurance if it doesn't actually cover shit? And you're still spending hundreds of dollars out of pocket. Like, I really just, somebody please make it make sense. And in honor of this one TikTok that I follow, Revolution.
Do you know how much I just paid to get routine blood work done, America? $83. In Canada, you know how much I paid for that? $0. I'm Canadian, but I'm a permanent resident in the US. And the cost of healthcare here is, it's insane. I've had MRIs in Canada. I've had blood work. I've seen a doctor. And you know how much I paid for those visits? $0. I never paid anything. I don't even think they have a card reader there because they don't expect payment. Because it should be free. I am lucky that we can afford the $83 for routine blood work. Extremely lucky. And we have good insurance. I have good insurance. We have a PPO. And none of this applies to deductible anymore. It used to. We have not changed insurance in the 7, 8, 10 years I've been here. And every year it goes up. It used to be $25. And now $83. Last year I didn't pay $83. I don't even think I paid $40. What is happening? It should be $0. It should be $0. And that's all I have to say. And for those of you who are going to be like, taxes are higher in Canada. Have you seen the taxes here? Because it's not great.
I really want to rant because I hate insurance. I absolutely hate it. The fact that I have to pay to live pisses me off. The fact that I also have to pay to a certain amount to, I don't know, insure me. And the fact that you get to choose what meds I can take when it matters what you... Every person's different. And the fact that you're like, we can't cover this one. What's the fucking difference? Tell me, what's the difference? Stuff that works for me, I'm not gonna fucking change it. I'm so angry right now. I'm so angry at insurance. I'm so angry. I wish insurance didn't fucking exist.
Our health insurance just sucks. Anyway, so my husband got his open enrollment stuff from his work. End of December. Don't know why we're just not getting it. Anyway, I want to show you guys something so that maybe some other countries can understand, because I don't want to live here anymore. So this is our medical plan options. Family, because it's my husband, myself, and our 2 girls. This is a weekly cost, not a monthly, a weekly cost of $335 a week. That is insane. Who can afford that? Who can afford that other than the freaking elite? Seriously, we don't make that much. Ignore the fancy house, okay? We renovated everything ourselves. We put a lot of work into this house. It's been years. But we're broke. And this is the fucking shit.
Why am I paying $500 a month for health insurance that doesn't want to cover anything? Every single time, new medication, this, that, they're like fighting everything. They don't want to pay for it. They say, oh, you need this, you need this. It's like, I thought having better insurance meant things would be easier. I don't know what's happened. I know health insurance has always been kind of scammy, but like in the last 5 years or something, or even more recently, I don't know if it was from COVID or what, but it's like they don't want to cover anything. They are just shamelessly stealing people's money. And I think the worst part about it is when you see these commercials and these ads and they're like, we care about your health, or like, you know, Blue Cross, like we care about you, or Healthy Life, or Kaiser, all these people that are saying they want to help you and they want you to be healthy. They don't. They really don't. They just want your money. They don't want to pay for shit. To add insult to injury, when you get the bills of these things, they just mark everything up like the most ridiculous stuff. It's like a spit test or something like that, and they're like, that was $40,000. We saved you $40,000. It's like, on what planet was that actually $40,000? They're just making these numbers up to say, oh, see, you had these savings. It's like, no, I had to pay hundreds of dollars for this test anyways, when the test probably cost less than that. But you're saying it costs, you know, this insane amount of money. They're like, well, we saved you $10,000 here, and da, da, da. It's like, no, you didn't, man. You're just cooking the books. Like, just stop, just stop.
So I got a letter from my health insurance this weekend of them saying like, hey, we think you have another health insurance, so we don't want to pay for your doctor's visit. And I was like, well, I don't have another health insurance. Please pay for my doctor's visit. And they're like, well, we need you to fill out all these forms now confirming that you have this other health insurance. And I'm like, can you explain to me why you think I have another health insurance? They're like, well, we don't, but we need to confirm that you don't. And I'm like, but I don't. And they're like, well, we think you do. And I'm just like, it was an endless cycle. And I'm like, what information do you guys have that makes you think I have another health insurance? And they're like, well, we don't have any. Then why are we having this conversation? Just pay for my freaking doctor's visit. I just love the fact that we have to pay all this money for health insurance only to have the health insurance say, yeah, we're not going to pay for any of the things you actually need.
This is not a new or original complaint, but I just coming on here to chime in about why am I paying almost $300 a month for insurance coverage for me and my family, and then I still have to go to the doctor and pay $2,500 before they start covering 80%, and then I have to pay up to $5,000 before they start covering more stuff. What am I even paying for each month? And that's not on top of what my employer pays. So my employer, I pay almost $300 a month, and they pay almost $1,000 a month, I think. That's what I'm looking at right here. Anyways, where's all that money going?
This isn't how a healthcare system is supposed to work. When people are paying into insurance plans that deny them basic care, when families are going into debt just to stay alive, and when profit matters more than patients, it's clear something is deeply broken. The truth is, many Americans aren't just sick, they're sick of being exploited. If you've ever felt powerless navigating this system, you're not alone. Share this video. Tell your story, because the more we speak up, the harder it becomes to ignore. Everyone deserves care. No one deserves this.